Hello everyone, happy Black Friday. You see that, make it extra black. Anyway, I was about to say something and then President Trump jumped on the podium and announced a national emergency, okay? I guess it's, very fitting that it's on a Black Friday, that we have a national emergency. Anyway, I want to talk about the government strategies. Okay, first of all, the China's approach. Okay, in the beginning, there's, really blind optimism from them. They say we shall defeat the coronavirus like how we did in 2013 with the SARS. Okay, that's the beginning. Well, the way beginning they're denying it, and then they're mobilizing and shutting everything down, and then they say we're going to defeat it. But after a while, it panned out that it's not as easy as they thought, because their past experience really does not help in this case, because SARS had to have some sort of symptom to manifest itself before you're contagious, and not this time. This COVID-19 is, you can be spreading it before you know it, okay, before you even know you have it. Okay, that's why they have a change of perspective. Now they say we need to go to work, and or the country would collapse, which is kind of true, because of the economy, everything, we gotta stay alive. Their other strategy is to just to report only the good news is the only good news is, okay, and then they play a numbers game, okay. So they're only reporting so many deaths, so many cases, as I have spoken in past videos in details, that all those numbers are phony and unbelievable. There are signs of optimism from China, from the inside sources, from the people, from my friends basically and families, that they are being cautiously optimistic. President Xi went to Wuhan, which is a big move. He's done nothing literally during this time, hiding behind the curtains, and then telling people that he's controlling everything, but he's not really done much. If anything, he's imposed his will on other people not to spread any sort of news that's not in their narrative, so which suppresses a lot of data and just simple stuff from the world. But nowadays things are getting out regardless, and there are things we can just know by knowing certain moves that they made. Now their attitude is more like live with it. We'll try to learn how to live with it, live with the results, and wait for the vaccine. So they have to mobilize everybody to go back to work, and then if more people get infected, they'll have to deal with it. They have accumulated some medical knowledge how to take care of people, and they are willing to let some people die. I mean, it sounds bad, but there is very little choice as a country's leader and government. We're talking about government's strategies. It's still not about politics. It's not about who's right, who's wrong. I'm just breaking it down for you, so you understand that what their mentality is and what the reasons they have behind their thinking, right? So this whole thing is that they'll learn to live with it, and then wait for another vaccine or some sort of effective measure to sort of get it under control. And until then, they're just going to have to let people, be contracted, but then quarantine, isolate them. So one thing they are doing really well is testing. Okay, I forgot to put in there. They test as many people as they can. Testing. Okay, there's I've spoken in the past that they do not have good testing kits, right? Their efficiency is very low. Their accuracy is very low. But what they do have is this experience. They have really high power, quick running X-ray machines. You can run a CT scan for the lungs really quickly over there. And then they have these mobile units. They just set up a tent and then they can do it. And with that, it's really awesome, because they can go about different things. They don't need to identify the virus. They just need to identify the symptom, and then they can just start quarantining the people who may have it. Wow, they're pretty good. I did a calculation back then. Like, they could be 70 to 90% effective in their ways of identification. So they've gotten really good at it. So hats off to the health workers over there. And also, they don't have a lot of regulations they have to go by, like not unlike here. So they're good at testing. That's what we're lacking here in the U.S. We don't have testing. We don't have this kind of experience. People are tied down by a lot of regulations. That is why Mr. Trump the president just announced that we have a national emergency. What that means, not only they get a lot of emergency funding in place or on the move, they also allow medical working personnel to exercise their best judgment on the spot. Okay, they don't have to wait for bureaucracy to decide on things. That's crucially important because the speed that you can act and you can react to certain situation really determines how fast we can do things. A lot of the old regulations is set in to really keep people from abusing those power. Those are good, but in this emergency, we should discard those and then focus on our effort to react quickly and immediately. So with that, I'm really optimistic that because the medical people, they're really good. We have the best in the world. We have to say that. Just the fact that they got into medical school and went through all those things. All the doctors are fantastic. They understand what to do and they can make good decisions on the spot. Anyhow, so the Western strategy is still sort of in formulation. So we have the expert predictions. In the last video today, I spoke about that. The expert panel have the same assessment. So if you want to know what the predictions are, go back to watch some of my videos talking about those things, especially my first and second and a couple others. And then there's a public sentiment. What will be? Well, I don't know what the public feels. You're the public, so you know how you feel about these things. I think there's increasing intention. There's probably fear growing, but some fear is healthy. I mean, I haven't seen anything. Well, there is still like unhealthy fear that resulted into people acting stupid. But mostly, I think the awareness is growing tremendously. There's a healthy sense of fear because fear can keep us alive as a species. So the public sentiment, you're the public, it evolves from not just day by day, but hour from hour, which is a good thing. People are starting to really take it seriously. That's good. Now, the only thing we're lacking is the testing. Okay, so that thing, hopefully, this emergency declaration can help resolve. They dedicate more funding and allow the medical personnel to do their own things. Maybe the laboratories, they can start using different things, different methods to try to identify persons that are affected, and with that, people can be more careful and start quarantine themselves and reduce social activities. We really need to bring the social activities down to a minimum. That's been my whole message, to really delay everything. Okay, so that's our sort of the Western strategy, but it's coming into play. It really depends on every person involved. It is a system going to be by Dr. Campbell's assessment, by the people, of the people, by the people, and for the people. So we are our own caretakers. Okay, we are our own. We are one for all and all for one. We are in this together. We take care of each other. We take care of the people next to us, and we take care of ourselves. And we don't get infected. Once we get infected, we're a threat to other people. So let's try not to get infected. Let's protect ourselves. Masks. Again, masks don't work perfectly, but they do offer some sort of shield. If you learn how to wear it properly, there's superb advantage in that. You cannot just brush over the facts that China has been doing much better, because of everybody in the public wearing a mask. There's even if it's a thin layer of protection, it is nevertheless a protection. So reduce that factor of transmission by a little bit, just a little bit at a time. It can mount to tremendous value. Okay, so don't dismiss any sort of measure. Don't go crazy on it. Masks is going to be, if everybody wears a mask every day, then we don't have enough production for that. So that's only wear it when it's when you are in close proximity in some sort of events. Even though nobody's coughing, nobody's doing anything. If you're having a meeting, in-person meeting, wear a mask. Just protect yourself, protect others because you may be carrying it. We never know. So each person that we can save from contracting or delay from contracting, even that can do tremendous help. Okay. Alrighty. So that sort of put us in a dilemma. So sometimes the governments need to take measures, and then they need to say, okay, what is my bottom line here? Do I worry about economy, or do I worry about lives? How many lives are we talking about? If we lose 1 million lives, the economy is surely going to really take a hit, because we need people to be in the economy. The economy is essentially of the people, what people do, what people purchase, and what people produce. But in life, these are individuals. One person has one life. This is not Jumanji. We don't have 3 lives. So how do you value one life versus a million lives. In this case, we have to value the one life first, right? It's sort of like Ethan Hunt in the latest Mission Impossible movie, Fallout. He saved his friend and lost the nukes and jeopardized millions of lives. Okay, and that's the whole premise. Well, go watch that movie. It's pretty good. Yeah, you have to value every single life, and if we do that, then we, as a society, we're better. The sad thing is that, for example, in Milan a couple of days ago, doctors have to face the choice of saving one life versus another. Okay, so these are moral dilemmas. We can talk to philosophers and all the ethics scholars all day about this, but it's basically our value system. Our value system sort of really points us to care for one another individually first. Okay, so this is the of the people, by the people, for the people, one for all and all for one. Okay, so in times of crisis, it really puts our value system in question. What do we do? How are we? Not what we claim ourselves to be. Okay, you can look at President Trump and look at his behaviors, personal, and just before he was a president, and he was fighting on MMA stage or something, or not MMA, but the wrestling and those kind of things, silly things that he did. But when it came to it, right, he declared national emergency, and it's a good move. It's a good move. He shut down the traveling to Europe. It's a great move. Okay, it might be devastating for some businesses, but think about it. We're protecting every single life first. Okay, and after that, if we can get through this, if we can really win this battle at the end, win this war against this coronavirus, it shall be a victory for all humanity. Thank you, and happy Friday. Have a good weekend. Keep up, and I think it's a good time to reflect. With all the downtime we have on hand, everybody should. I think it's it's more of a sabbatical. People should take a look at it as a sabbatical collectively, as a society, because we need to take a Sabbath and reflect on our values, and reflect on what's important to us, lives and money and well-being. What does it mean? What is happiness? And reflect on the bravery that we're trying to live up to, as we claim. And we don't cry. We don't cry in baseball. This is baseball. Life is a game, but we take it seriously. Come on, Americans, put on a game face. Let's do this.